Hyperparathyroidism is an excess of parathyroid hormone in the bloodstream due to overactivity of one or more of the 4 parathyroid glands. There are 4 parathyroid glands located behind the thyroid gland. Parathyroid glands monitor and control the amount of calcium in our blood and bones by secreting a hormone called parathyroid hormone or PTH. Each gland monitors the blood calcium and responds by making more or less PTH hormone. Hyperparathyroidism is a disease that occurs when one of the parathyroid glands develops a tumor. This tumor produces far too much parathyroid hormone, which is released in the bloodstream. The excess parathyroid hormone travels through the blood and enters the bones. The hormone activates cells within the bone to eat away at the bones, often causing osteoporosis, fractures, and bone pain. The destruction of bone releases calcium into the blood. High blood calcium levels are seen in almost all patients with a parathyroid tumor. The excess calcium can build up in the arteries, increasing atherosclerosis throughout the body. This can lead to high blood pressure and increased risk for heart attack and stroke. The high calcium often affects the electrical system of the heart, causing atrial fibrillation and palpitations. The excess blood calcium built up in the kidneys, forming kidney stones and occasionally causing kidney failure. High calcium levels also affect the brain. Since we use calcium in the electrical system of our nerves, a high blood calcium is associated with a slower nervous system, which gives symptoms of tiredness, memory loss, and poor concentration. Many patients with high blood calcium have chronic fatigue for this reason. High calcium levels have an effect on the stomach and intestines, often causing gastroesophageal reflux disease, also known as GERD, and abdominal discomfort. High blood calcium is even associated with higher risks of several cancers, including breast, prostate, colon, and kidney. It is estimated that untreated hyperparathyroidism can decrease the patient's life expectancy by 5 or 6 years, even when the calcium is only slightly elevated. Hyperparathyroidism is cured by surgical removal of the parathyroid tumor. Parathyroid surgery is a straightforward outpatient procedure that can often be completed in less than 20 minutes. Since as many as 30% of patients with hyperparathyroidism will have more than one parathyroid tumor, your surgeon will examine all 4 parathyroid glands to be sure a second tumor has not been left behind. Once that parathyroid tumor has been removed, the disease is cured.